I had a huge brain cyst that was fluid filled. My kids call it the fog. I would sit in a chair and eat and stand up to get a drink of water and fall down. But when I came in and they discovered the cyst, they did surgery right away.
So one of the first things we do when we have a patient admitted to the trauma floor is we get the rehab services on board.
So Vicki and I met on the acute care side of the hospital right after she had had her brain surgery. And immediately she conveyed to me that she was incredibly motivated to get back to her prior level of function.
I wanted to be here at Mary Free Bed at Trinity Health because I knew that I would get a lot more intensive therapy, and I was so ready to get back up on my feet again and get going.
So some of the deficits were significantly impaired balance. Anytime that you have that sort of issue with the brain, you're going to have problems with your speech and your cognition and ability to think.
She was someone that was very independent before this, was driving, caring for herself, doing chores around the home. So as a speech therapist, I had to figure out how we could help her memory and her concentration to be able to do those things safely and independently.
They would have me do puzzles. They would give me different mnemonic devices to remember things. And every day we would do physical therapy, things to help with my balance, things to help with my coordination, things to help with even climbing stairs. In the occupational therapy also, there's a room here that's set up like a apartment or a house, and they would have me try and, make a meal or make something and do just the normal things that you would have to do around a house. I was only here, I think, just under 2 weeks. And from going to not being able to function to walking out of here with a clear brain and able to be on a road to recovery, it was just astounding.
A lot of times when they show up in our outpatient office for their follow-up after they've been here, they ask if it's okay to come back to the unit, which I always encourage because it's what keeps all of us going, is to see where these patients are.
You look beautiful.
Thank
Holy
you.
moly. Oh my God.
Oh boy.
And it's so good to see you.
And I came back and I was surprised. When I showed them the picture, they're like, oh my gosh, they were so happy.
When I looked at her pictures, I'm like, no way, this cannot be you.
It's kind of like a result of their work, all of the effort they put into me and the effort that I put into me really made me blossom.
Not only can we see the progress that the patients have made while they're here, but when they come back and connect with us, we see that they continued with that progress.
You gotta want to get better, and you have to know that you can. You have to know that you can, and that there are people out there who are willing to help you get better.